Health and Social Services has confirmed the outbreak of Crimean-Congo Hemorrhagic Fever. This follows after a patient from Gobabis died and whose laboratory test results confirmed that the patient died from the virus. Executive Director of the Ministry of Health and Social Services Ben Nangombe now joins us with more. Ms. Nangombe, good evening and thank you so much for joining us here on the Daily Roundup.
Good evening, Nina. How are you?
I'm good, thank you, sir. Thank you so much for joining us.
Yes, you're welcome. I'm happy to be here.
For the sake of clarity for our viewers, Mr. Nangombe, just start by telling us what exactly is Congo fever?
Crimean-Congo Hemorrhagic Fever is a viral hemorrhagic fever caused by a virus called the norovirus. It is transmitted to human beings through the bites or crushing of ticks, or handling ticks with bare hands, or through contact with the body fluids of a patient who is infected with the Crimean-Congo Hemorrhagic Fever during the acute phase of the infection. It can also be transmitted to human beings by coming into contact with the tissues from livestock that had the CCH-AGF in its blood.
And is this fever highly contagious, and what are the symptoms that comes with this virus?
Yeah, indeed, it is quite contagious. That is why when there is an outbreak of this kind, the necessary measures must be put in place to ensure that it does not affect or is not transmitted to more people. The onset of this disease is quite sudden. Once you are infected with it, the symptoms are almost immediate. And they include quite a number. A person may suffer from headache, high fever, back pain, joint pain, stomach pain, and vomiting. There could also be indication of red eyes and a red throat if the person is infected by a medical officer. Mm-hmm. So the symptoms are quite severe. A person starts literally bleeding through vomiting blood, for example, bleeding through the body orifices and things like that.
Ms. Nangombe, what does the ministry currently know about the disease movements and how many individuals they've come into contact with? The ministry did reveal that they're monitoring contacts in Gobabis and Windhoek.
Yes, the patient who was first treated is a named patient, a farmer from the Gobabis area. This person was treated at a private health facility in Gobabis on the 15th of May 2023, was later transferred to Lady Pohamba Private Hospital at the 17th of May, who then transferred the patient to the Windhoek Central Hospital on the 18th of May 2023. So it was quite a quick reaction that was taken. And once the patient had been transmitted or admitted to the Windhoek Central Hospital, the blood samples were immediately taken, but unfortunately it passed away in the same day of the 18th in the early mornings. Mm-hmm. We were notified in the laboratory that the tests were positive for the Crimean-Congo Hemorrhagic Fever on the 31st of May 2023, after which we activated the necessary actions to deal with the outbreak. Because according to the protocols of the Ministry of Health and Social Services, even a single case of Crimean-Congo Hemorrhagic Fever that is positively confirmed by a laboratory, we then had to deal with it as an outbreak.
Our government also activated an emergency committee. Help us understand why there was a need for that.
Yeah, as I said, when according to our protocol, even a single case of Crimean-Congo Hemorrhagic Fever is treated as an outbreak, and for that reason, the mechanics within the ministry are that the Health Emergency Committee must meet in order to ensure that we put the necessary action plans in place to deal with the disease. This is dealt with on the basis of a whole of government approach in terms of the One Health principle. So this committee also then has membership and engages with the Ministry of Agriculture, Water and Forestry, because this is a zoonotic disease. It's a disease that can come from animals to human beings. So in this case, the Ministry of Agriculture, as the entity responsible for veterinary medicine and veterinary issues, has to become involved. That is why the committee was activated in order to ensure that the relevant departments in the government are dealing with them.
Just lastly, Ms. Nangombe, how is Congo fever treated?
Well, the disease does not have specific treatment per se, but what happens is supportive treatment that is provided. A person who is infected can be given supportive treatment in terms of, for example, ensuring that there is fluid balance in the body of the patient in terms of being placed on fluid treatment. They can be placed on oxygen, for example. There will be blood therapy in terms of blood transfusion as necessary. And these are the supportive treatment that can be provided, but there isn't a specific treatment that can say, we give you this medication specifically to heal Crimean-Congo Hemorrhagic Fever.
Mr. Nangombe, thank you so much for joining us this evening. Always lovely speaking to you.
You're most welcome.
That was Mr. Ben Nangombe speaking to us on the line concerning